my own attitude with children has always been that positivity is really, really important. Um, and I do worry that sometimes these negative ideas are presented to children in films, in books, at school, with some of the sort of anti-bullying type policies, and some of them have very scary pictures, and children have to relive their experiences. And um, I feel that calmness and simplicity and positivity, and giving children confidence is so important. So when I came across the work of Peter Breggin, which is to do with whether children should be receiving drugs for ADHD, I found that very interesting. Now, Peter has produced 3 videos called Simple Truth, and I'm going to put a link to those at the bottom of here, because I'm not an expert. I'm somebody who tries to have an overview over things like health and world and food, and so I'm speaking very much from a different perspective. But he is a practicing psychiatrist, and he's done 3 videos about this, so I'm going to put the links to those at the bottom. What he's basically found in his long career and his work is that giving Ritalin and a cocktail of drugs or other similar drugs to children with ADHD can be extremely damaging. This has been borne out by medical research, which there was a particularly a research project done in the 1970s where they followed up children aged between 7 and 9 over a long period of time. And these children at between 7 and 9 had received Ritalin for fairly mild ADHD problems. They found that there was a huge increase in all sorts of problems in later life, including more likely to be hospitalised, more likely to be incarcerated, more likely to commit suicide, more likely to have depression, more likely to have brain problems, more likely to have anxiety. There was all sorts of things which he found to be true. So on his website, he's gone on to publish 5 principles and 5 reasons why he thinks children should not have this medication. The first reason is to do with side effects, and this is a problem that encompasses all psychiatric drugs really, and that is that the very thing that the drug is trying to cure is often also a side effect of the drug. So if you're taking a drug for depression, it can often cause depression. The same is true with Ritalin. A lot of the side effects, aggression, and so on and so forth, can be caused by the drug. So this is one very big reason why it's often not beneficial at all to take it. There are other reasons. He feels that it reduces the child's feeling of self-mastery. And so what I was saying earlier about positivity, in that I think it's very important that children feel safe. They feel that anything is possible. They feel that there aren't limiting factors or diseases which hold them back. So I think in terms, this is the sort of terms that Dr. Peter Breggin is talking about when he's talking about that he feels it impedes the child's self-mastery. He also feels that it can have negative impacts on the way that the parents relate within their parenting. In a situation where no medication is offered and a child is behaving badly, it will simply be that other techniques will have to be found. And in my opinion, the best techniques are going to be the most holistic ones, those that focus very much on the relationship and the love and the nurturing of the parent and the relationship with their child. That for a child is obviously the most important thing. And then also obviously looking at things like food, um, stimulants, particularly within food, things like sugars, artificial sweeteners, colorings, that sort of thing. The overall health of the diet, things like exercise, um, things to do with the family routine, um, all of these holistic things which can come in and form a part. And of course, the other very important thing is giving the parents support. So if the doctor or the family practice is able to give you a drug for your child, then in a way they feel they're providing a solution. If they're not able to do that, or they're not going to do that, then perhaps they would use probably more resources and more money to offer you parenting classes or parenting help or assistance for you, to enable you to help your difficult child. And obviously parenting is a hugely difficult and demanding task. So there are very, very many cases when parents do need an enormous amount of help. The other point that Peter makes, which I found really interesting actually, and I found that has been something that's been borne out in my own experience of sort of nurturing family and friends, and that is that your own feeling about the other person has a huge impact on how they feel in terms of making them feel safe. So what he was saying was, as a therapist, that if a person is presenting with what seems like terribly aberrant behaviour, terribly upset or anxious or distressed or aggressive or violent, he says the more calm you are and the more you normalise the behaviour, the more you feel that it's okay as a therapist or as a parent, then the more that okayness transfers to the other person. And so it's really worth having a look at that.